Good afternoon, everyone. Today I will be discussing evidence-based practice changes in healthcare. I see evidence-based practice as a mixture of the best available evidence, clinical expertise, and what is best for the patient. However, there are some barriers that interfere with evidence-based practice. For example, the hair loss after flu vaccine via social media and OB anesthesia techniques from social media groups are clear examples of unreliable evidence from a narrative that overshadows structured data. Social media amplifies emotional compelling stories which can mess up the perception and trust in vaccines or promote off-label practices without pharmacological rationale or safety data. We must recognize that evidence-based practice cannot be substituted for social media claims. When it comes to a coworker who refuses to update practice because they've always done it this way, reflects resistance to change and demonstrates over-relying on personal experience. It's true that clinical expertise is essential, but when there is a high-quality evidence or updated guidelines suggesting safer or more effective approaches, sticking to tradition or experience alone is no longer ethically defensible. Senior clinicians should demonstrate true professionalism by changing their practice and recalibrating their practice for the best interests of the patient. It is important to always ask ourselves when presented with new information, what level of evidence supports this? Do guidelines or systemic reviews align with this idea? Some barriers to appropriate evidence use include limited time to search and read literature, and relying on social media platforms for evidence. Some examples for bridging this gap would be having formal review pathways such as evidence-based councils and committees introducing high-quality evidence. Technology has been helpful but can also be harmful when it comes to evidence-based practice. Technology can be helpful when it comes to having quick access to clinical guidelines, databases, systemic reviews, and drug information. It is also extremely helpful when it comes to decision support tools and electronic health record that standardize evidence-based order sets, dosing, infection prevention bundles. However, technology can be harmful to evidence-based practice through social media spreading and misinformation or algorithms that are marketed as smart or AI-driven, but they do not have any high-quality evidence behind them. However, at its best, technology accelerates access to reliable evidence. As nurses and future CRNAs, we must do our due diligence and make sure that we are accessing high-quality evidence-based practice and that we are not misled on social media or other poor quality information out there.